are live on CTV Talk City 91.1 FM, streaming live on ctvtt.com. We invite you to drop us a line on any of our various social media platforms. We'd love to hear from you. Also, feel free to download our CTV app, where you can get the very latest in news and current affairs and trending topics here, even on our very own morning show. Well, Dr. Errol James is an American board-certified plastic, cosmetic, and reconstructive surgeon, Trinidad and Tobago born, and he's here to share his journey and his work with us. Dr. James, a pleasure to have you on. Welcome.
Thank you for having me.
Now, we're very excited to hear about your journey, having studied at so many different places, and that field of study, working with burn patients and all these different very challenging areas. First of all, where exactly in Trinidad were you born, and did you come from a family of doctors?
I was born in Woodbrook on Ryson Road.
Okay.
As far as the second part of the question, I do not come from a family of doctors. I did have an uncle who was an island scholar in 1914 and thereabouts, and had gone away to study medicine, but then the war broke out, and because the funds were not enough, he changed his discipline, became a teacher. But I have always wanted to be a physician from the time I was small. And it is something which, fortunately for me, and by God's grace and my family's grace, I was able to have it materialize.
Yes. What was that journey like? Did you come from a poverty-stricken home?
Not poverty-stricken as such. My father, at the time, was when I was young, he was a member of parliament for Southeast Port of Spain, and he was defeated by Dr. Williams in '56. He was always involved in community work, as was my mother, in terms of organizing downtown carnival and that sort of thing. They were the ones who did that in those days, back in the '50s. We always had enough, and I was graced in that regard.
Yes. You also have siblings?
Yes, I have a brother and a sister, and my sister lives in Trinidad still. My brother lives in Atlanta.
Great. What level of education did you attain here before you decided to travel abroad?
I did my high school at QRC.
Okay.
And then I traveled in 1968, went to Canada, pursued a bachelor's in sociology and also biology. And then in 1973, I went to Dublin, to the Royal College of Surgeons, where I started reading in medicine. Finished in 1979, was very homesick at that time, and I came back home, did my internship here for 1 year, then I worked in casualty for 6 months, then I went off to the United States, where I was accepted at Columbia University at the campus of Harlem in New York City. And I did all of my general surgery there. And I also did my plastic and reconstructive surgery there, including burn surgery, because that center is one of the only 2 burn centers in New York at the time. So we saw a lot of burns, and we saw a lot of burns, especially in the upper Manhattan area, which is less affluent than the downtown area. And I believe the burn center is still in existence today, in spite of austerity measures and so forth, simply because of the numbers of burn cases we did in those days.
Did you always want to specialize in surgery?
Once, I think before I started actually going to medical school, I would have thought of something else, like preventative medicine or something like that. But once I started the medical school, especially in a school like the College of Surgeons, where there's just so many surgeons, not just practicing but teaching, you're influenced by that.
Right.
And to a great extent, it fit nicely with me because I like to use my hands. And I would look at some of the videos on people like DeBakey and so forth, who was a great cardiac surgeon, who learned how to knit. So he could knit, and it helped him in his surgery.
I want to talk a little bit about that, your ability to use your hands. Is it that gives you the edge as a surgeon? Is it all what you know in terms of your academic knowledge, or is that extra skill something that also gives you the edge, having steady hands?
Well, I think it's a combination, but it's a very good question. Thank you for that. In terms of using your hands, especially in plastic surgery, and probably also in all branches of surgery, that facility that you have in terms of having good function is very important. You don't want your surgeon to be a clumsy person, someone who drops things all the time and that sort of thing. But I do believe that there's a marriage of the intellect and the physical ability. And in plastic surgery, there's also another aspect to it. It has to do with the aesthetics. We all say, as plastic surgeons, that what makes the difference between a good outcome and a bad outcome is a sense of balance. Sometimes patients come to you and they can't quite say what it is they don't like about themselves. But once you talk to them for some time, you realize there's a lack of balance. Something that is a bit off to them. And it's that ability to capture that from them and then to try and satisfy their need that I think makes it very rewarding and very challenging at times.
What are some of the most challenging cases you've had to work on?
Well, obviously I think I should say that plastic surgery is divided into two big categories. You've got the cosmetic surgery on the one hand, such as the facelifts, the neck lifts, the breast lifts and that sort of thing. And then you have the reconstructive side, which means that you're trying to reconstruct things that have been damaged or things that someone may have been born with that are out.
Like a cleft.
Cleft lips, cleft palates, that sort of thing, ears that are prominent, eyes that are probably droopy and that sort of thing. And that's where you try to give them back good function and good balance, as I said. As far as some of the most challenging cases, of course, are burn cases. Yeah, because when someone is burnt, say, more than 30% of their body surface, or even less in some cases, depending on the size of the person and so on, there are two aspects of that treatment. One is first trying to make sure the patient survives. That requires good hydration and so forth, and good ICU care, intensive care. And then the second, of course, is then trying to reconstruct and to cover the burn areas. First, you have to remove the dead skin, and then you have to put new skin on top of that to try and get them functioning and back into society.
There are so many other questions I'd like to ask you as well.
Thank you.
Unfortunately, we're out of time. However, I'd like to know, where are you located? Where is your practice?
Yes, our practice goes under the name of Beacon Plastic and Reconstructive Surgery, and it's located at 50 Louis Street, L-U-I-S Street, in Woodbrook, Port of Spain, between Robert Street and Aria Peter Avenue.
Is there a number that we can call?
Yes, it's 628-8314 and 701-4212.
Agreed. Well, hopefully we'll have you back on set so we can go into detail about some of the strategies you use.
Precisely, and it's educational too.
Yes, of course. Thank you so much, Dr. James. We take a short break. We do have another interview up next, so stay tuned.